Yeah, so I'm Dr. Dev Persaud. I'm an internist and also infectious disease specialist working at Georgetown Hospital.
So that means that you're the right doctor to treat people with COVID-19.
Well, yes.
Yeah. So could you tell us what happens if a person tests positive for COVID-19?
Well, generally, even before a patient is tested positive, in our setting, the patient would have been seen at more than likely the East Street triage gate. At that point, if we suspect that they're ill and it is probably COVID-19 and they need to be admitted, we would admit them to the 10th hospital. And while they're there, usually we don't only say the patient has COVID-19 full stop. We come up with what's called a differential, and we would treat for the other illnesses as well. Because if it doesn't turn out to be COVID-19, we wouldn't be starting pretty late. We would have already started. More than likely, it might be a case of a pneumonia, for example. So while the patient is awaiting his or her results, they would be under that 10th hospital. When the results are back, at that point, we would make the decision to take them up to the unit. And the major criteria for getting into the unit is if patients have respiratory distress, and we envision that they would have a really hard time if they were to go home.
Explain what respiratory distress means.
So, in layman's terms, a person would find that they would start breathing faster, and even if they don't start breathing faster, they would find that they experience shortness of breath on minimal exertion. So let's say one day you go to the shop and you're quite okay. Another day you find that you walk and you come back and you're out of breath. Those are the major presentations that we see, and why they are concerning is because they usually indicate that this person here will need some kind of support more than just tablets that they can take at home.
And now you treat patients with what we know as the malaria drugs, correct?
The malaria drug is part of the protocol that has been adopted by the hospital, and we are implementing it as part of our treatment plan as well.
But what happens if those medications don't work and a person can't breathe on their own?
So, when a patient is ill and in the unit, we generally divide our treatment into pharmacologic and non-pharmacologic interventions. So in addition to giving them medications, we would usually try to do recruitment exercises to help to recruit more of their lung capacity.
How do you do that?
So this might entail cough exercises every hour. Sometimes it may also include prone positioning, so the patient may need to lie down on their abdomen or their belly for periods of time, because these have been shown to help as well. These are measures that we implement, but in addition to that, the patient usually is on oxygen. The way we escalate care, if these are not enough, would be to sometimes have oxygen from not one but two sources. And ultimately, we may need to put a tube down that patient's throat and attach them to a ventilator, which will help them breathe as well. We have had several such circumstances thus far.
Okay, and of course you've had some deaths here.
Yes, we have.
Without giving away confidential information, how does that person reach that point where they could eventually die?
Again, it is in the respiratory distress.
Okay.
What's interesting to note is that of the patients that we have seen who unfortunately have not done too well, we have had not what the public knows to be older persons or patients necessarily with comorbidities, but we have actually had young men, mostly young men in their 30s, who are affected, and that, I must say, was a worrying circumstance for all of us who are in this effort.
Doctor, so what can persons do to protect themselves and others so that they don't end up in the hospital?
As it is being said everywhere, I would just reinforce the idea of social distancing. And by that, I must say that social distancing doesn't only mean keeping your distance from a bar, it also means keeping your distance from people around you. So even if you're at home with other people in the home, let's say you have 3-4 other persons in the home, it also means when you are at home that you keep your distance from them as well. In addition to that, frequent hand washing Definitely, if you are in an area where you have flowing water and soap, that would be the preference. And carrying hand sanitizers would help as well. I know there is a wearing mask campaign, and that is part of the effort, but it can only be useful when it is combined with all of the other things I would have mentioned before.
And doctor, you're one of the young doctors. You've been telling me before that this unit is staffed by all young people.
Yes, as it is, all of our members, or majority of our members, I would say, let's say 95% of us are in our 20s and 30s, and certainly it is a challenge working in that environment, but I must say that it's not an individual effort, it's an effort as a group, and it's an effort that I'm proud to say that all of our colleagues, whether they're doctors, nurses, cleaners, everybody has been respectful thus far, and we are finding ways to support each other because it is a very high stress environment, and when we can support each other in this effort, it can only enhance our efforts. And in addition to that, I would probably say that as part of the care of our treatment, we have been ensuring that patients know who we are and that we're talking to them because we understand from their perspective as well, seeing people or not seeing people because we are all suited up can be taxing, but we're working on it.
Yeah, thank you very much.
You're welcome.